So does electrical stimulation actually help to improve your pain? Well, let's find out. So electrical stimulation utilizes a unit that produces electrical impulses through the skin to apply its effects. There are a variety of different types of electrical stimulation, such as NMES, which is neuromuscular electrical stimulation. There is FES, which is functional electrical stimulation, and there is TENS, transcutaneous electrical nerve stimulation, which is the one that we will be talking about. And depending on the different types of settings that you apply to the unit, such as pulse width, frequency, and intensity, you can address different types of fibers by producing electrical impulses at different depths through the skin. First, we have the A beta fibers, which are the largest. You have medium A delta fibers and the smallest C fibers. And it doesn't matter which fibers you address because they all result in inhibiting sensory signals from being sent to the central nervous system or the CNS, because unless the brain processes this information, it will not be perceived as pain. Because the definition of pain isn't necessarily that it is a result of an injury, but it is an actual or perceived injury resulting in the pain. And on the other hand, we have an increased production of hormones such as endorphins to address the pain as well. Now, there is plenty of research stating that it will address your pain short term. However, research hasn't really shown that there are long-term benefits in addressing pain. Now, I'll leave all the research right over here. And if you want to dive a little bit deeper into the mechanisms of how electrical stimulation works, I'll leave that article right over here. So what does this mean for you? Electrical stimulation shouldn't be used as a sole treatment intervention for addressing pain, but rather as a supplement to exercise, which is shown through research to have long-term benefits in pain, and to be used prior to any events or performances where you want to perform at your best and to provide that short-term pain relief through electrical stimulation. So now that we've gone over all the mechanisms, research, and uses, let's go over how we can utilize electrical stimulation to address our pain. So you're going to start off by grabbing your stim unit and attaching all the cables and stim pads to it. You are then going to apply the stim pads to the skin in the areas that you want to address. Once you got that all set up, you can go ahead and turn on your unit, and luckily with the modern types of units, you don't have to manually address each setting, but rather choose the type of electrical stimulation that you want to use. Once you've chosen that, you can manually increase the amplitude or decrease it to a tolerance that you can handle. What you want to feel when you increase the amplitude is somewhat of a subtle paresthesia or like some kind of weird tingly feeling. And it should generally be somewhat uncomfortable, but it shouldn't be painful. And of course, if you use something that requires more muscle activation and you want to see some of that muscle pulsing, you can increase it to the point where your muscles start to twitch. And I want to remind you, regardless of the type of TENS that you use, they're all going to result in the same type of pain relief effect. Now, if you're curious about the different types of TENS, then I'll leave all the parameters right over here for you to look at. Now, if you have any questions or you want to learn a little more about TENS or the other types of electrical stimulation, let me know in the comments or message me privately. Until next time, peace.